Hi, this is Courtney with PRMA Plastic Surgery. I am joined today with Dr. Ramon Garza, and we are going to be chatting about lymphedema. So, Dr. Garza, can you just to kick us off here, can you just give us a breakdown of what lymphedema is?
Sure. Good morning. So lymphedema is an abnormal swelling that occurs in the extremities. For breast cancer patients, it's related to prior surgery, usually when lymph nodes are removed from the armpit area during an axillary lymph node dissection or a sentinel lymph node biopsy. Much less common in a sentinel lymph node biopsy, but it can occur. The lymphatic system, which helps control the fluid in the upper extremity, and also helps with immune function, is disrupted. And when that occurs, it can cause that fluid to build up and cause swelling in the arm area, and we call that lymphedema.
Okay, and what steps can breast cancer patients take to reduce the risk of lymphedema?
So the first step is to make sure your surgeon is evaluating you for lymphedema. And if you're a high-risk patient, that's something that if you're not hearing it from your surgeon, you need to inquire and ask about it. So the high-risk patients are those patients who, again, have had lymph nodes removed. 10 or more lymph nodes is the kind of a key number, 10 or more lymph nodes removed from the armpit area, have had chemotherapy, radiation therapy, or they're going to get radiation therapy to the chest or to the axillary area, or the supraclavicular lymph nodes, or patients who also have a BMI higher than 30. Those are the patients that are most at risk for developing breast cancer. So the first thing to do is have a discussion with your surgeon and see if you are a patient that fits one of those categories. And if you are, it's important to get plugged in with a lymphedema therapist to help mitigate some of the potential complications of having those risk factors. With the current situation with COVID-19 and the infections, and patients aren't able to have the same access to healthcare providers, it's important to maybe establish a relationship with a lymphedema therapist, or at least communicate with them. And a lot of times they can teach you home methods for manual lymphatic drainage that you can do in your house. In addition to that, just maintaining good skin hygiene. Moisture is very important. Thankfully we're kind of getting outside the winter time period, but during winter times or colder climates, you can have skin cracks from dry skin with low humidity, and maintaining good skin hygiene and moisture with lotions and creams can really help prevent from having a complication such as an infection, which can lead to a lymphedema situation.
And what symptoms should patients look out for if they're concerned about being high risk for developing lymphedema?
Good question. So the most common thing that patients will complain of is kind of a heaviness in the upper extremity. Swelling is what we classically think of when we think of lymphedema clinically. But the earlier stages of lymphedema, some patients may not have any visible swelling or objective measurement swelling, but they will complain of heaviness, or sometimes just kind of a dull ache in the arm area. Some patients will notice that they have kind of a loss of dexterity in their hands, particularly if it's their if it's their dominant hands. For example, a right hand dominant person may say, you know what, my dexterity, my finger fine movements aren't as what they used to be in this arm, and I feel it's just a little bit odd. Those are kind of symptoms that you should be careful for. Of course, swelling. If you wear rings, you may notice your rings fit a little tighter than usual. Clothing also may fit a little differently than it would otherwise. And those can all be indications of lymphedema.
Okay, and if a patient suspects he or she has lymphedema, what should they do currently?
Yeah, so again, I think the best course of action would be to reach out to your general surgeon and see if they have a lymphedema therapist that they would refer you to. And depending on whether or not that lymphedema therapist is able to evaluate patients, again, a lot of things have changed because of the situation that we're in, but they may have some literature that can outline things you can do at home, again, with the self-care, the manual lymphatic drainage, some things you can do at home. There aren't any good studies on using lymphatic brushes or dry brushing, but these things can be found even online on Amazon. It's something that I routinely recommend my patients It can help. I don't think it would hurt at all, but it can help stimulate the lymphatic system. It's a very light brushing the lymphatic system in the extremities. Is very superficial. It's not in the muscles, so it's not a massage. You would feel the same type of depth of pressure you would in a regular massage of your muscles. The lymphatic system is very superficial in the skin, so if you have the opportunity to get manual lymphatic drainage by a therapist, you'll notice that they have a very light touch. And I think this dry brushing can also help with that, but it doesn't obviously doesn't replace the professional certified lymphedema therapists with their techniques, but it's something that can be used as an adjunct, particularly during this time period.
Okay. And what are the treatment options for lymphedema? You mentioned the brushing. Is that, I guess that's just to help with the symptoms, but are there actual treatment options for patients who are diagnosed with lymphedema?
Yeah, so again, the first thing is to make sure you're evaluated by a lymphedema therapist to determine if you actually do have lymphedema. And once that's determined, or if you're very high risk and you're going to see a plastic surgeon, that's one thing to ask a plastic surgeon if they offer any treatments for lymphedema. There are surgical treatments. These are newer treatments. Not many surgeons are able to do this type of surgery. At PRMA, we do specialize in comprehensive restorative breast care. So we do, obviously breast reconstruction. But we also do lymphatic surgery for patients that have had lymphedema. And there's two main treatments. One involves transfer of a lymph node to help replace the lymph nodes that were removed. And the other involves something called lymphaticovenous anastomosis, or also known as a lymphaticovenous bypass. And that's just a way for us to physically reroute the lymphatic channel to the venous system, and it can help bypass the obstruction from the lymph node surgery.
Wonderful. All right. And just to kind of wrap it up, for patients who may be interested in seeking an opinion on if they are a good candidate for lymphedema surgery, during this time of the coronavirus outbreak and our office being closed currently, how can patients reach out to us via telemedicine?
Yeah, so we
resources?
Great question. We take patients from all over the country, even before this whole pandemic. And we are set up to do virtual consults. So we have patients come from other parts of the country, other parts of the world, and we're able to do via telemedicine evaluations. So that's a perfect way for the patient to have a consultation from the comfort of their home without having to venture to a physician's office. We do an initial intake, and then we can do like a Skype interview and discussion, and see if you are a good candidate for pursuing a lymphatic surgery.
And what surgical options are PRMA offering right now?
So we do the lymphaticovenous anastomosis, or the lymphaticovenous bypass, the LVA, and we also do the lymph node transfer. With the lymph node transfer, we're mostly doing that with patients who require breast reconstruction. So it's done in conjunction with the breast reconstruction. The lymphaticovenous anastomosis is done as a standalone procedure.
Okay. All right. Well, thank you so much, Dr. Garza, for chatting with us today. We appreciate it, and I'm sure we'll chat again soon.
Great. Thanks.